Did you know that doctors are now prescribing highly addictive narcotic drugs for period pain? Yeah, well, neither did I. I just learned about it. Now, call me late to the party, but I think that that is one of the most irresponsible things to do as far as choices on how to deal with menstrual cramps or menstrual pain. I do have another solution if you are willing and if you are ready to just kick that pharmaceutical style pain treatment to the curb. So just stay tuned to this video and I promise you will not be disappointed. Blink and you may have missed it. There was an article that came out over a year ago in 2023 with Nicki Minaj, that is a rapper, a very famous rapper, and she was speaking about her addiction to painkillers. Now, as for the reason why she became addicted to the painkillers may actually blow your mind, unless I'm just late to the party, but her doctor actually prescribed her a narcotic, an opioid, folks, yes, to deal with period pain. Now, I've never heard of this in my life until then, and I took my time because I wanted to research a little bit more to understand why a doctor may give such a powerful, addictive, and negative habit-forming substance to someone just to deal with period pain. And I really could not find an answer. But I can imagine that people have very demanding careers. People really don't feel that they have the time to deal with any type of pain. And I don't blame the patient at all, or the person that is in pain. I don't blame them at all. But when something so heavy is prescribed to someone, it should be explained. And as I read, she said it really wasn't explained to her that it can be such an addictive substance. And it actually did cause addictive problems in her life to get off of these drugs, finally. So if your doctor is suggesting anything similar to you, ask more questions. Is it habit forming? You know, I would actually say to do your research. And if you do that research, you will see that opioids have been a part of a very destructive paradigm that's been sweeping the nation. It has included people either robbing, stealing, and I'm just speaking about the doctors that sell and push these drugs onto, you know, maybe poorer communities and people that are dealing with severe pain, you know, maybe from amputation, maybe from an old injury or something like that. And they now have a habit, and it is destroying their lives and it's destroying the lives of their loved ones from dealing with that. And the doctors, the pharmaceutical companies really come across as really having no heart. But I should take that back. They actually have a heart for the billions and billions of dollars that they are making through selling you a bunch of crap to put in your body to deal with pain. Now, you may think I'm on a soapbox. I'm not on a soapbox. I'm in a human form just like you. I have nerves, pain endings. I feel pain, and I do suffer with period pain occasionally, and more so the worst of those days are behind me. I'm only bringing this up so you know that there is an alternative. You do not have to suffer. You do not have to miss days of work or miss days of plotting your world domination, of taking over with your wonderful business and services that you have to offer everyone and to expand and help the world, to love on your loved ones, your friends, your family, to actually take those travels, wear your white bikini, whatever you want to do. You don't have to suffer. And I am just letting you know that for me, doing a raw vegan food diet, it has dramatically changed the way period pain or cramps actually show up. I do feel a little something in the lower region, as far as in my uterus area, when the bleeding phase is about to start. I think that's normal. I don't even think that if you are going to have a period, you don't want to just have it come upon you, right? So it's a little warning. Okay, I feel a little something. And when I say a little something on a scale of 1 to 10 as far as pain, I literally mean like a 1 and 2. Like, oh, maybe a little zingy. And I don't even want to say sharp pain because it won't stop you in your tracks. It will just be like, oh, I feel a little cramp or something. And it'll just go away. It's like a zing, like an electric feeling, and then that's it. It's like a warning, like, okay, it's coming. Maybe not even at that moment, but you may feel it a couple days before, you know? But the people that tell you that diet has nothing to do with period pain is full of shit, or they just not on what I'm on, okay? So whatever, that's just my point of view. So turn off if you want to see those guys talk about whatever else, and that's fine. But watch this and continue to watch this if you want to know what exactly I did personally. And I can't say this is going to work for you, but I am 9 out of 10 sure. I am 90% sure that this human body that you see before you has nothing that is very, very different than your human body. And that if you eat and eliminate, then diet does have an impact on pain and pain receptors, nerve endings, how you perceive pain in the body, okay? So I'm not just gonna talk about physical stuff that the raw vegan food diet can do as far as your physical body, but also, and mental is physical as well, but the psychological effects and the mental effects on how this raw vegan food diet can actually handle these hormone intrusions, right? What it feels like when the period time comes. So whether you have PMDD, which is also like PMS, which is before the actual bleeding phase of your period, which usually is marked by mood swings, feelings of deep depression, maybe even suicidal thoughts, you know, which I've dealt with personally. And you might feel like you're going crazy. You might take things out on people and just not even understand what's happening, especially if you don't chart your cycle, if you don't know if it's like 25 days or 28 days or 32 days. You don't know when to look for these symptoms to actually come up. So you're kind of caught unawares and you're like, wow, why did I just, curse my husband out or whatever the case is? And you're like, damn. And then you look at the calendar and you're like, whoa, okay, that was a hormone surge. But this diet can even reduce that. And it's not just diet. I actually do take some pharmaceutical supplements. And I actually do take some herbal things as well. And some vitamins, to balance those hormones out. So without any further ado, I'm just going to tell you what I do and what I did. I commit to a fully raw vegan diet to reduce my period symptoms starting last year. And if you want to know more about that, you can watch that video and I'll link that below. But a fully raw vegan diet. And after a few months, there was actually 1 or 2 or maybe even 3 months at this point where I felt literally no pain. And the blood flow, I would say, is maybe 90% reduced as far as the blood flow. What else can I say? The period pain and the quality of it, the sharpness, is non-existent. I don't take any painkillers. Haven't taken painkillers for a period or for various different things, even a headache or even muscle spasms or from a workout or anything like that, or hitting my elbow. Never, for the most part. If I do take a painkiller, I'm really, really low mentally because I know what repeated month after month, day after day, just not even narcotic level painkillers, not even narcotic level painkillers, but the Advils, the aspirins, the acetaminophen of it all, those actually can wear away the stomach lining. And it is not good long term anyway for your health. So you have to kind of put a question mark. What is it worth? Do I reduce period pains, get on with my life of dominating my world, or is there an alternative? Again, because we don't want to really sit with that type of pain. There's no need for you to. If you want to, you can. It does pass. It will pass. And there are like hot compresses, cold compresses, hot tea, things like that you can do to soothe yourself from the surges of pain. But you do have to have a lot of time. You do have to rest, perhaps sit down a little more. Less exercise around that time is definitely recommended. So if you really don't feel like you want to give yourself that option, you don't want to deal with that type of pain, and that is perfectly fine. So fresh fruits, fresh vegetables, little nuts and seeds. I would say an 80-10-10 diet if you can do it. But over the months, I didn't do that at all. Now, I never really had high fat in this year of raw vegan food diet, but I did have my fatty days, but for the most part, it was easy to follow. Why was 80-10-10 easy to follow for me? Because I had a vision. I had a strong ass why. Because I'm one of those beings that do not want a period. I do not want PMDD, PMS, whatever they rebrand that as. I don't want heavy flow, light flow. I'm a no flow vibe, not menopause, a no flow person. There are people like that that exist. Look that up on your own time, or maybe I'll bring videos to that up, to you. But there are people that do not bleed, but they do ovulate. So that means you are able to have kids, but you do not necessarily have to bleed and inconvenience yourself in that way. If you want to, and you want to feel like that's a woman and it's dear and close to your heart, go for it. But for those who are intrigued or interested, then obviously continue listening. So an 80-10-10 raw vegan food diet, mostly fruits and fresh vegetables, some sprouts as well, is required, is what I do. I do take some vitamin supplements when I am bleeding to balance what my body, the nutrients that my body is losing through vital blood that I feel should be inside of my body. Doing great work. But anyway, on the way there, I am supplementing. And when it comes to, I would say, my personal feeling of crazy, which I would never call another woman crazy, but I can do that for myself. I feel crazy. It's not a scientific term. When I feel like my boundaries is going a little haywire and bonkers, I recognize that as a hormonal imbalance. So for my mental, I have been dipping into, for the past few months, nootropics. Now, years ago, I tried 5-HTP for like depression and anxiety with no results. Turns out I probably wasn't taking a high enough dosage. Now, I'm not a doctor. I'm not telling you what to do. I'm just telling you what I did. And maybe you want to look into this, either with a doctor or whatever healthcare professional that you trust. And nootropics actually do a lot of good things for how you process things in your brain, how you process information mentally, in the world around you. And, as you know from watching a lot of my other videos, I feel like the mind is very important when it comes to life, when it comes to doing any type of action, any type of regimen, any type of diet, which in essence is a lifestyle change. So your mindset is very important. And any outside help you can get with that, I would take it, But again, the choice is up to you. Now, if you find this video helpful, I have loaded the description chock full of information that can help you. And just at your leisure or at your emergency, take a look at these products, at these services that I link down in the description in this videos if you need more help. And I'm making this video so people don't feel alone, because when you are going through, say, PMDD, and you have like suicidal thoughts, or you have thoughts of gloom and doom, maybe even homicidal type thoughts, and you know it's not your personality. That's the weirdest thing. I never hear people talk about this too much, but you know it's not your personality. It is your hormones, you know? And I understand if you don't trust doctors to call a suicide hotline or something like that, which is something that you can do if you feel like you do have suicidal thoughts. But if you feel like they're gonna, I think it's like 50-50 on you or something like that, like, try to lock you away for whatever type of mental illness they want to prescribe you with. I get it. Who wants to lose their freedom, right? But you do want to be heard. I will say a few things. Talk to somebody. If you don't join a community and talk to, like an online community that understands where you're coming from, speak to a friend, speak to anyone that you feel like will listen, right? And know specifically that it will pass. But I am not BSing you, okay? You can change your feelings. You can change your body image, how you feel in your body, with the raw vegan food diet. Now all you have to do is give it a shot if you think it makes sense to you. Less of whatever you've been eating, meats, ultra-processed food, vegetarian, slightness, little cheese here and there. Cut it out for a certain amount of time. 7 days, 30 days, 3 months. Specifically for the period, you want to go a little bit longer.